Your results are a mirror of your effort, your discipline, and your sacrifice in life, in the gym, your body, your health.
1 and 2. It is an infectious disease.
Effort. You can talk all you want. Results don't lie. Effort doesn't lie. When it's game day, when it's showtime, those who talk but haven't worked, the work they've put in will be seen by everyone. Those who kept their mouths shut and worked when no one was watching, their work will be seen by everyone too, but in a much different way. Which one do you want to be?
Face-to-face talking or
Sacrifice.
skin to skin.
If you don't sacrifice for what you want will become the sacrifice. And you will have to settle for a life you do not want.
Or kissing the skin. Respiratory droplets or short-range aerosols from the prolonged close contact. The virus then enters the body through the broken skin mucosal surfaces like oral, pharyngeal, ocular, genital, or anorectal, or via the respiratory tract. Mpox can spread to the other members of the household and to the sex partners. People with multiple sexual partners are higher risk. Animal to human transmission of the Mpox occur from the infected animals to the human from bites or scratches, or during activities such as hunting, skinning, trapping, cooking, playing with the carcasses, or eating animals. The extent of the virus circulation in animal population is not entirely known, and further studies are underway. People can contract Mpox from the contaminated objects such as clothing or linens, through sharp injuries in the healthcare or community settings such as tattoo parlors. The signs and symptoms. Mpox causes signs and symptoms which usually begin within a week but can start 1 to 21 days after exposure. Symptoms typically last 2 to 4 weeks but may last longer in someone with a weakening immune system. The common symptoms of the Mpox are the rash, fever, sore throat, headache, muscle aches, back pain, low energy, swelling lymph nodes. For some people, the first symptoms of the Mpox is rash, while others may have different symptoms first. The rash begins as a flat sore, which develops into the blister filled with a liquid and may be itchy or painful. As the rash heals, the lesion dry up, crust over, and fall off. Some people may have one or few skin lesions, and others have hundreds of or more. These can appear anywhere on the body, such as the palm of the hands and sole of feet, face, mouth, and throat, groin, and genital area, in addition to the anus. Some people also have painful swelling of the rectum or pain and difficulty of urination. People with monkeypox are infectious and can pass the disease on others until all sores have healed and the new layer of the skin has formed. The children, pregnant people, and people with a weak immune system are at risk for the complications from Mpox. Typically for the Mpox, fever, muscle aches, and sore throat appear first. The Mpox rash begins on the face and spreads over the body, extending to the palms and soles, and evolve over 2 to 4 weeks in stages. Macules, papules, vesicles, and pustules. Lesions dip in the center before crusting over. Scabs then fall off. Lymphadenopathy, which is the swelling lymph nodes, is a classic feature of the Mpox. Some people can infected without developing any symptoms. People with mpox can become very sick. For example, the skin can become infected with a bacteria leading to the abscess or serious skin damage. Other complications include pneumonia, corneal infection with loss of vision, pain or difficulty of swallowing, vomiting and diarrhea causing severe dehydration or malnutrition, sepsis, inflammation of the brain, encephalitis, heart, myocarditis, rectum, proctitis, genital organs, balanitis, and urinary passage, urethritis, or death. Persons with immune suppression due to the medication or medical condition are at higher risk of serious illnesses and death due to the mpox. People living with HIV that is not well controlled or treated more often develop severe disease. The diagnosis. Identifying mpox can be difficult as other infections and conditions can look similar. It is important to distinguish mpox from the chickenpox, measles, bacterial skin infections, scabies, herpes, syphilis, other sexually transmissible infections, and medication associated allergies. Detection of the viral DNA by polymerase chain reaction is the preferred laboratory test for the mpox. Best diagnostic specimens are taken directly from the rash, skin, fluid, or crust collected by the vigorous swabbing. In the absence of the skin lesion, testing can be done on the oropharyngeal, anal, or rectal swabs. Testing blood is not recommended. The treatment and vaccination. The goal of the treatment of mpox is to take care of the rash, managing the pain and prevent complication. Early and supportive care is important to help manage the symptoms and avoid further problems. Getting an mpox vaccine can help prevent infection. The vaccine should be given within 4 days of the contact with someone who has mpox or within up to the 14 days if there is no symptoms. It is recommended for people at the high risk to get vaccinated to prevent infection with the mpox, especially during an outbreak. This includes the health workers at the risk of exposure, men who has sex with a man, people with multiple sex partners, and sex workers. Persons who have mpox should be carried far away from other people. In addition to the several antiviral can be used,